for this question, students were asked to talk about anterior protrusion of the sternum. Anterior protrusion of the sternum. So this is kind of like you are bringing soft tissue pathology into what orthopedics. Okay, anterior protrusion of the sternum is like your chest is big like this. Do you understand? So there's a proper name which they call it. Okay, so anterior protrusion of the sternum is the same thing we call the pectus what carinatum. Okay, it's pectus carinatum, bro. Okay, or pigeon chest. Okay, pectus carinatum. So it's a chest wall deformity where the breastbones and the ribs they push outward instead of lying flat. Okay, so definition is it's actually a congenital chest wall deformity. Is characterized by the sternum and the ribs they are going outward. Okay, other names you can have pigeon chest, protruding sternum, chest protrusion. Okay, it's like that. So appearance, the chest may look ridge like, okay, peak like. I'm actually seeing you, bro. Okay, hole shaped, or sometimes it's asymmetric. In the video I actually have a picture, so everything I'm recording here is video per video, so I'll upload it later. Okay, so causes, it could be congenital, all right, where there's imbalanced growth of the sternum and the costal cartilage, that's during childhood. It could be genetic factors, that's it can be associated with some other disease conditions like Marfan syndrome, McCoy syndrome, trisomy 21. So sometimes it could be rapid growth. We are still talking about the causes of the what Pectus carinatum. So it could be rapid growth during puberty. Those are abnormalities still. Then sometimes it could be after a surgery. They did probably an open heart surgery. Okay, yeah, it's also associated with rickets. Okay, so they could do an open heart surgery and probably they didn't actually fix it back rightly. So you're having what? A Pectus carinatum. So I have the pictures here. Now, issues that such patients will be having is they'll have a visible chest protrusion. So for cosmetic reasons, they might not actually like it, you know. So sometimes they might have shortness of breath, that's issues with breathing and all of that. And if they want to do exercise, they're not really tolerant with exercise and all. Then sometimes chest pains, but it's rare. Okay. Then for psychological problems, they don't like the way their body's looking, social anxiety, low self-esteem, you understand, that kind of things. So diagnosis is physical examination. You can see it. Okay, it's something that you can see it. You don't need laboratory tests, you can see it. They can also want to do images like chest x-rays and CT scan just to see what is inside. Okay, then pulmonary function test to see how the person is still breathing and all of that. So treatment options. If the person is still a child, you might use braces to actually correct that. Okay, chest braces, just like the braces they use for the teeth. There are braces for the chest too, could actually correct that. Then surgeries, if the braces fail, there's a surgery known as a ravage technique. Okay, those ones we'll talk about is when we are fully into orthopedics. Okay, we'll talk about all the surgeries. Okay, other supportive cares like physical therapies for posture, breathing exercise, then psychological support to help the person, talk to the person to accept themselves the way they are. Okay, so this is it for the anterior protrusion of the sternum.